Hello everybody, this will be discussion 4 in Nursing 452. For this discussion, we were to select a topic and identify a disparity that goes along with it. The disparity that I chose was listed under the uninsured topic, so I clicked that topic and read through some of the several different disparities, and I chose limitations of the program being used for uninsured COVID-19 patients. I thought that this was probably a relevant topic with the past year's events with COVID-19 patients. So when reading about this disparity, I learned that the current coronavirus treatment reimbursement program for uninsured patients was announced in early of April last year, and so it's been in place for several months now. The program uses money from the CARES, or the Coronavirus Aid, Relief, and Economic Security Act, to reimburse providers and healthcare facilities for treating uninsured patients with COVID-19. So one of the biggest factors that limits the reach of the Health and Human Services program is that uninsured reimbursement is contingent on a primary diagnosis of COVID-19. So in some cases, patients with COVID-19 who are being treated for symptoms brought on by the virus might not have the primary diagnosis of COVID-19 through their whole hospital stay. So a good example of that would be if a patient becomes septic from COVID, their primary diagnosis may then turn into sepsis and not COVID. So basically what all that means for this bill is that they may be billed separately, and if the patient is uninsured, they could be billed directly for these stays. And when uninsured patients pay for their own care, their bills are calculated using undiscounted prices, which are typically higher than the Medicare rates that are paid through this program. So this can be a big problem for our patients that are uninsured, because they might have really high bills due to them having a secondary diagnosis of COVID, and then this program not covering their entire stay or all of their treatments. This could also cause some of our patients to not seek healthcare due to they might be unsure of the cost or unsure what can all be covered. So I think that this could be improved by this program covering treatment for all COVID symptoms. If a patient has been diagnosed with COVID, covering the treatment for the symptoms that go along with COVID, as well as other disease processes that might follow with COVID, such as if it would lead to sepsis. I think that this could help our patients take care of their bills and help them come into the hospital a little bit sooner if they're not so worried about the costs. Thank you.